All right, we'll go ahead and get started. Vice Mayor Jordan is here. Go ahead and call this special meeting to order. And will you go ahead and do a roll call for me, please?
Councilmember McQuay,
Here.
Councilmember Nason,
Here.
Councilmember Tiedemann,
Here.
Vice Mayor Jordan,
Here.
Mayor Gary.
Here, thank you. See if there's any public comments before we go into special session. Doesn't look like there appears to be. With that said, we'll go ahead and go into closed session. Thank you. regular meeting. We'll go ahead and call this meeting to order. And if you can give me a roll call, please.
Councilmember McQuay,
Here.
Councilmember Nason,
Here.
Councilmember Tiedemann,
Here.
Vice Mayor Jordan,
Here.
and Mayor Gary.
Thank you. And we'll go to item number 3, which is reportable action on closed session. City Attorney, if you can go ahead and report out.
Thank you, Mayor Gary. The council gave direction to staff.
All right. Thank you so much. We'll go ahead and move down to line item number 5, the city manager's report. Go ahead.
Thank you, Mayor. City Hall and the community center are anticipated to open on July 6th, and that means open our doors. While we have been continuing to serve our community virtually and through many other different means throughout the pandemic, we'll actually be able to see folks in person again. This is definitely a momentous occasion, and we're absolutely looking forward to it. We're making some changes to try and make in-person visits even easier. Please stay tuned for some additional opportunities that will be posted to our website and shared out on the option of making an appointment for certain services. This will also include our passport office, which will be by appointment only. We have received our recertification from the Department of State, and we will have passport hours starting on July 8th, Mondays and Thursdays for the interim period from 9 a.m. to noon. And again, that will be by appointment. Also, you'll see some transition with a lot of our other services as we turn back to the post-pandemic world, if you will. We will be opening our senior center for meals beginning on July 1st. The Albany Senior Center will offer both grab and go curbside meal service, as well as on July 14th, we will serve a lunch at 11:30 on Wednesdays and Thursdays on site, and registration will be required for that service. Meals on Wheels will continue to be delivered. And again, if you have any questions on any of that, contact our senior center at 524-9122. Our Friendship Club has opened back up, and that is for childcare services and summer camps. Those have been very well received. Also, for neighbors anxious to get together, we have now began accepting block party applications again. So please see our community center to obtain an application for a block party. Moving on to other program updates, phase 4 of the sidewalk repair project is substantially complete. Thank you to all who had to bear with us as we went through some construction. You will see any sidewalk that has been repaired with one of the sidewalk rehab signs. And that's just another great project that we have on an ongoing basis. Stay tuned for the next phase of that work. Albany Fire Department has been actively engaged on the Hill. They conducted a drill with Berkeley Fire Department as they provide support to Albany to refamiliarize themselves with Albany Hill and confirm their ability to access all fire roads on the Hill. Both engines from both companies drove the fire roads from Pierce Street up to Taft and on the fire road along Cerrito Creek via 535 Pierce Street access. Also, the fire department has been conducting daily hill checks where personnel physically hike the hill at various times of the day during the week. And this will continue throughout this year's fire season twice a day. When we are experiencing red flag warnings. We've also sent out our annual fire safety notice to residents on the hillside area. That completes my report.
Thank you so much, City Manager. Next, we'll move out to items number 6, which is good of the city, public comment. This is time for the public to come in and engage and provide 3 minutes of items that are not listed on the agenda. With that said, I'll go ahead and turn it over to Ann. If you can go ahead and let the public in. Please raise your hand and Ann will bring you up and unmute you.
We don't have any hands raised.
Have any public comments? All right, then.
Oh,
We'll
I'm
go
sorry.
ahead.
Hold on a second.
Okay.
One.
Go ahead.
Good evening, Council, Mayor and Council. Nick Chair, Albany resident. As we examine the ongoing housing crisis and as we work on the San Pablo Avenue specific plan and the upcoming housing element work for the general plan, I think the council needs to look at a couple of ballot measures for 2022 that might be needed in order to allow us to have the flexibility to meet our regional housing needs allocation goals, our RENA goals. And that would be continued reform of the past Measure D, which we reformed already by removing the parking part, but which also specifies single family zoning throughout the city. It would be better if the city council had the flexibility to change that zoning and remove that from the provision from Measure D. Also, Measure K prevents us from zoning Albany Hill in order to have a dense housing project on the west side of Albany Hill, where there's still private property. So I would request that the city council bring back for an agenda item the discussion of reforming previous Measure D and Measure K for the 2022 ballot. Thank you.
Thank you so much for your comment. Next, I have Pat Young. Go ahead, please. Your mic is muted if you're speaking.
Pat, are you able to unmute yourself?
Okay. Maybe she's having technical difficulties. Okay. Any comment that you may have, you definitely can send it to the city clerk and the city council members, and we will address it at that time. Oh,
Can you hear me now?
we can hear you now. Go ahead, please.
Thank you. I'm so sorry.
Right,
I was trying to. Anyway, I just wanted to say thank you to Mayor Gary and the Albany community for the Juneteenth festival. I enjoyed it immensely, and I brought a friend with me. She also enjoyed herself, so I'm looking forward to next year. Thank you and have a good day.
Thank you for your comment. Let's make sure I don't miss anyone. All right, it looks like I captured everyone for the comments. All right, we'll go ahead and move down to line items 7 for the consent calendar. We'll go around the room and I'll start with Councilmember McQuaid.
7475.
Councilmember Tiedemann? Nothing? Okay. Councilmember Nason? Nothing. Vice Mayor Jordan?
7-1.
All right, we'll go ahead and see if there's anyone in the public would like to pull anything. All right, I'll go ahead and bring it back to council. We'll start with Vice Mayor Jordan, 7-1.
Yeah, thank you for preparing the minutes, City Clerk. I think there was a leftover sentence regarding under announcements regarding my announcing that the mayor was speaking at the Gilman interchange project groundbreaking. That I think was from prior minutes because that actually happened before the last meeting. So that just needs to be struck, if I'm not mistaken.
Thank you.
That's it.
Thank you, Vice Mayor Jordan. Councilmember McQuaid, 7-4 and 7-5. You want to do back to back?
Okay, I'll start with 7-4. This is a proclamation for Fire Chief Lance Calkins' retirement. And I just wanted to comment by thanking Lance for his 7 years of service with the city of Albany. I've worked with Lance on many projects on disaster preparedness, and we served together on the League of California Cities Public Safety Policy Committee. And I just wanted to let him know that I really appreciated his availability and his willingness to discuss fire safety and emergency services with me, including walking the Hill and looking at different options there, and to wish him the very best in his retirement. And on a similar note, if I can just keep going.
That's fine.
To Eileen Harrington, that she's been with the city almost 20 years, which is an amazing career. And I want to thank her for all the help she's given me over the time I was both on council and prior to that. She always had a smile and a kind word, and making time to chat, which usually was about our beloved Giants. And again, I wish her the best in retirement and hope it's full of adventures and good times. Thank you.
All right, thank you so much, Councilmember McQuaid. Do I have a motion to move the items on the consent calendar?
I'll move.
Okay, you second, Vice Mayor?
I will second with the adjustment to the minutes.
Yeah. All right, we'll go ahead and take a roll call.
Mayor Gary,
Yes.
Vice Mayor Jordan,
Yes.
Councilmember McQuaid,
Yes.
Councilmember Nason,
Yes.
and Councilmember Tiedemann.
Yes.
Motion
All right.
carries.
Thank you so much, Ann. Moving along, we'll go to item number 8 for the presentation, and I'll turn it over to City Manager or staff.
Please give me a minute while I bring up the staff.
Okay, thank you.
Okay, good evening. The item before council is a presentation on mobile crisis services provided by Alameda County Behavioral Health, or ACBH. The staff report includes a brief description of recent changes to mental health services available to Albany residents. I will highlight a few here. As of July 1st, 2020, Alameda County is the sole provider of mental health services to Albany residents. Alameda County Behavioral Health's Access Program is a system-wide point of contact for information, screening, and referrals for mental health and substance use services and treatment for Alameda County residents, including Albany. County mental health services also include a wide range of inpatient, residential, and outpatient services. Most Albany residents with Medi-Cal use Alameda County's access line to receive outpatient therapy and psychiatry through contract providers funded by the county. Before July 2020, the city of Berkeley had been providing level 1 and full service partnership services for Albany adults. Berkeley had also been providing a very low level of children's mental health services. For any person currently in service, Berkeley has continued to provide services to prevent service disruption if preferred by clients. Alameda County also recently implemented health street teams throughout the county in collaboration with Lifelong Medical Care to provide people who are experiencing homelessness improved access to medical and mental health services. The health street team coordinates services with BFHP, the city's homeless service provider, and participates in the city's monthly case conferences. One key area for focus is mobile crisis services. Starting July 1st, 2021, Alameda County will be providing mobile crisis services to Albany. Mobile crisis services are typically called upon when there is a more urgent situation that potentially also involves coordination with the police department. Berkeley has continued to provide mobile crisis services to Albany through fiscal year 2021 and used the time to cost out these services. At the end of fiscal year 2021, which is June 30th of this year, ACBH could either choose to pay Berkeley to continue providing those services or provide them directly. Berkeley determined that the cost to provide mobile crisis services to Albany was about $45,000 per year. So ACBH informed Berkeley and Albany that they will provide mobile crisis services to Albany starting on July 1st, 2021. Stephanie Lewis, Division Director of Crisis Services at ACBH, is here this evening to present some information. Staff continues to seek ways to further enhance mental health support services for our community, particularly in partnership with public safety. While research is preliminary at this point in time, some of the potential opportunities being researched include continuing to retain mobile crisis services from the city of Berkeley to supplement the services that are being provided by the county, and coordinating with other small cities to explore the development of a joint crisis services unit to respond more effectively to calls for services. This concludes my overview of the staff report. And as I mentioned earlier, Stephanie Lewis, Division Director of Crisis Services of Alameda County Behavioral Health, is here this evening to present information on county mobile crisis services. So
I didn't know if it was okay for me to go. So I'm Stephanie
Yeah.
Lewis, the Division Director for Alameda County Behavioral Healthcare Services. And Isabel, should I share my screen? Okay. Oops. That's not working.
Stephanie, do you want me to try to share?
Yes, please,
Okay.
because it's not giving me the option. There we go.
Oh, thank you, Anne. She was quicker than me.
All right, just gonna put it in slide mode.
I'm sharing it from the information uploaded on the web, so it's not in the PowerPoint mode, but I can scroll through.
Okay, we'll just scroll through. Okay, so next slide. So Alameda County Behavioral Healthcare Services is currently providing 3 types of mobile crisis teams throughout Alameda County. I'm going to focus primarily on the first model, which is the clinicians, because that is the model that would be responding to calls in the city of Albany. So it's 2 licensed clinicians. They respond countywide. We have, we split the county by 2 right now. So we have a team that responds in the North County area, which includes the cities of Alameda, Oakland, Emeryville, Piedmont, and now it will be Albany. And our staff are licensed clinicians. They're designated to evaluate for psychiatric hold, so 5150s or 5585s. And we are looking to divert individuals to appropriate levels of care when they don't need to be hospitalized. And the services for the mobile crisis team are Monday through Friday, 10 a.m. to 8 p.m. We are dispatched in Oakland via 911. All other cities call us directly to request us. And the goal is to expand to weekends, staffing permitting. So we are currently recruiting for expansion. We also in Oakland have a model that we call the mobile evaluation team that pairs a clinician with an officer. They ride in an unmarked vehicle and respond in East Oakland. Another team that we have, which is currently a pilot, is called the CAT program, which is the Community Assessment and Transport Team. I'm not sure if you all are aware of this program, but a lot of cities are interested in this model. It's a 5-year pilot, and it's supposed to end in 2023. The cities that are included right now are Oakland, San Leandro, Hayward, Fremont, Union City, and Newark. So although I'm presenting on this, it's not an option for Albany at this moment. So it's really going to be the 2 clinicians responding in a county vehicle, and law enforcement can call us directly. The community can call us directly. Next slide. So we also have 3 types of outreach and engagement teams that respond throughout the county. We have Community Connections, which is field outreach specifically for individuals who are homeless. And the goal is to link them to homeless programs and mental health services and, a wide range of social services. We also co-respond with the street health teams. So those street health teams focus on primary care, housing, activities of daily living. And then when our teams co-respond with them, they're really focused on psychiatric assessment and connecting those folks to mental health services. We also have a team called Familiar Faces, which is our high utilizer team. And it is for individuals who have frequent contacts with law enforcement and or present at the local psychiatric hospitals. And usually these folks are not securely connected to voluntary services for whatever reason. They utilize more of our acute services or become the attention of law enforcement because people are calling 911 and reporting various things like aggressive panhandling or a person appearing to have a mental health condition in the community and not, connected to care. And so the goal of Familiar Faces is to engage these individuals in voluntary services and work with their assigned providers to do care coordination, of course, providing information and referral. And both Community Connections and Familiar Faces can transport individuals. So if, we're doing outreach and we think that a person would be better served by a wellness center or being taken to an urgent medication clinic or just being moved to a different location because it makes more sense in terms of services, those teams can do that. And then we have a post-crisis follow-up Crisis Connect team that reaches out to individuals 24 to 48 hours after a crisis event. We want to assess whether the person, the initial crisis has been resolved, and also to encourage follow-up care. As many of you may or may not know, 75% of those folks who go to John George Psych Emergency, whether they walk in voluntarily or they're sent on a psychiatric hold, 75% of those people are not admitted to care. They don't fit the criteria for admittance. So we really want to work with those individuals in redirecting them to an appropriate level of care. And this could be anything from going to a crisis residential treatment program, going to an urgent medication clinic, being reconnected with their assigned provider, going to a wellness center, going to detox or sobering, etc. Next slide. So how to contact us for services. So you can call us directly and the number is listed. It's our headquarters. The building is located in Hayward, but our teams are located throughout the county because we have teams that are responding throughout Alameda County. So we have offices in Oakland. We have a couple in Oakland. We have a office in Hayward, and then we have some satellites offices in our South and East County areas. Many of our calls are generated by law enforcement, but we also receive referrals from individuals, the community, the 24-hour crisis line, other agencies, local and the local government. We get referrals from board of supervisors, city council, if there's a ongoing chronic issue. So that would be the number that anyone who needed our teams would call. And I found a typo on the slide. We usually take calls as late as 7:30, so I will resend these slides as well. Okay, next slide. When individuals are calling, we ask that they use the SBAR model for consultation. It's a great way to provide information in a clear and concise way. And, you know, we're crisis workers, so sometimes we sound rushed when we're on the phone receiving information. So we just want to know what the situation is, whatever background the person may have, if they have it, what their assessment of the situation is. This person seems like they're experiencing mental health symptoms, or they look intoxicated, or they need something, and then what the recommendation is. Evaluate for hospitalization, or just come and see. We don't know what the person needs. We don't know. We just know that the person needs some help. And so we will respond. And when the community calls, they'll be talking to an on-duty clinician who will triage the call and make the determination of the best team to respond, whether it's our 2-clinician mobile crisis team or one of our outreach and engagement teams, because every situation doesn't require an urgent response. So we want to, you know, make the determination in terms of what team needs to respond. Next slide. And so how long does it take us to respond? Our goal is to get to calls within 15 to 20 minutes after receiving a referral for our mobile crisis teams. Our post-crisis follow-up responds 24 to 48 hours. Our outreach and engagement teams will respond same day and will continue and as long as it's appropriate to continue outreach and or until the person is connected to care. Our mobile crisis team's goal of 15 to 20 minutes is impacted, of course, by traffic. We're, you know, in a county vehicle observing the rules of the road. We get stuck in traffic. The teams are also very, very busy. So it is not uncommon for a call to come in and the team is already out on a call. So usually the caller will get an estimate of when the team will be available, and then we would call en route to say, you know, we're on our way, we're just finishing, and our ETA is whatever amount of minutes. Next. Thank you. So I just wanted to point out that there are situations that require law enforcement and/or paramedics. Our mobile crisis teams can respond without law enforcement, but it definitely depends on the presentation. So if the person is barricaded, if there's a threat of violence, if weapons are involved, if a crime has been committed, law enforcement would be involved. If the person that needs to be evaluated for hospitalization is somewhat resistant to our intervention or posing a danger to themselves or someone else, law enforcement would be involved. Our outreach and engagement teams frequently go out probably 99% of the time without law enforcement, because we have a little bit more time to triage those calls and do some research on what the call entails. When we get calls from law enforcement, of course, they're involved because the call usually originated with them. Next slide. We also have available to county residents urgent medication clinics. And so there's one in Oakland Community Support, that's in East Oakland. We have Tri-City Community Center, which is in Fremont, and Valley Mental Health Services, which is in Pleasanton. And these are low barrier walk-in clinics for individuals who need an urgent medication evaluation, but are not meeting the criteria for hospitalization. And so the hours are listed, and we always suggest that individuals call first and be able to, you know, walk into a waiting room, safely sit there for a little bit and go through a full assessment with a clinician. And then we use psychiatry through telehealth to do the psychiatric portion. And then the person would be able to go to a pharmacy and get medications. So individuals would have to have active Medi-Cal for this service. Next slide. We also have crisis residential treatment programs, J. Mahler, which is in San Leandro. We have Woodrow Place, which is in Hayward, and then Amber House is in Oakland. And what's unique about Amber House is that it is a crisis residential treatment program where individuals can stay up to 10 days. And it's also a 23 59-minute crisis stabilization unit. And so what happens is a person, may be in a mental health crisis. They don't necessarily need to be taken to John George on a 5150. And so if the person voluntarily agrees to present, and we can transport them, or they can go, with caretakers or whatever, to the crisis stabilization unit. They can be there for 23 hours, 59 minutes. At the end of that time period, if they need more stabilization, they can be referred to one of the other 3 crisis residential treatment programs. And so with Albany residents, most of them would be going to Amber House. And Amber House is, of course, just 24 hours. The capacity is 10 in our CSU and I think 12 in the CRT, and they are designated to write psychiatric hold. So if the person presents and they begin to escalate or decompensate further, Amber House can actually write the 5150 and arrange for transport to a LPS designated facility like John George. Next slide. We also have, crisis assessment and care for children. So for individuals 12 to 17, there's Willow Rock, and for youth 11 years old or younger, there is Children's Hospital of Oakland. Next slide. And these are just other crisis resources that are available in the county. Of course, there's the 24-hour crisis support services. They also have a text line. There's a national hotline number, and then the city of Berkeley. We haven't updated the slide to show, because it was previously Berkeley and Albany only. But we do collaborate with the city of Berkeley and their mobile crisis team. I actually worked there for 7 years and know many of the staff that provide the services at Berkeley. Next slide. And then we have specialty language services. So La Clinica for Spanish, La Familia. There's Asian languages that people speak Asian languages are served at Asian Health Services. And then the numbers for those who are deaf or hearing impaired. Next slide. And then Isabel shared a little bit about our access line. This is the countywide referral and assessment service for anyone looking for mental health services. There's also the substance use access and referral line. And so these entities work very closely with crisis services. So there isn't a wrong door. If a person is calling and trying to access ongoing care, and they're also in crisis, access can refer directly to us. Crisis support services, so their 24-hour crisis line, can refer to us. And sometimes it is, we dealt with the crisis overnight, but we want you guys to follow up when you get into the office. And so, so that collaboration works really well with those entities. Next slide. And this is just a little bit more about our Access program and where the calls go after hours. So like I said, there is no wrong number. If a person's calling Access after hours, they get crisis support services, and crisis support services is staffed by, licensed clinicians and also tons of volunteers who provide phone support 24 hours a day. Next slide. And who do we serve? So we serve Alameda County residents, Medi-Cal, Medi-Cal eligible, Medi-Cal, Medicare, Indigent Health Pack. And so this is all of Alameda County services. Crisis services are open to anyone who is in the county limits who's experiencing a crisis. So it could be a privately insured person, no insured, a non-insured person. If they are experiencing a mental health crisis and we are called to respond, we would intervene and make sure that person gets the care that they need. It's the follow-up care that is impacted when the person has private insurance, because we would have to refer that person to their private insurance provider. So say, for instance, someone's driving through Alameda County and they experience a mental health crisis and we intervene, we send them to the hospital. They have Blue Shield, Blue Cross. They would go to one of their providers' hospitals. They wouldn't go to John George. And once we finish our one-time intervention with them, our services would be done in terms of our intervention with them. We wouldn't be following up, and the hospital would be responsible for referring them to their provider. And then, for ongoing services in Alameda County, the person has to have some significant functional impairments due to a mental health condition. We do serve individuals who have co-occurring mental health and substance use, but there are some diagnoses that are excluded from our mental health services. They can be served in primary care, like lifelong. And those excluded diagnoses are intellectual disabilities, traumatic brain injuries, medically induced disorders, dementia, Alzheimer's, and other, things that are caused by medical conditions. But for crisis services, we see all these people. Next slide. And then this is just a little bit more information about specialty mental health services in Alameda County and what we provide. Of course, mental health services, medication support, targeted case management, crisis intervention services, crisis stabilization, adult residential treatment services, crisis residential services, day treatment, intensive services, day rehab, psychiatric inpatient hospital services, psychiatric health facilities, and how one enters into the ACBH system is through a call through Access. Of course, if a person is hospitalized, those social workers at the hospital would connect that individual to follow-up care through the Access program if they're not already assigned to a service. And next slide, which is the last one. Oh, no, it wasn't. So our substance use disorder system of care includes outpatient treatment, intensive outpatient, recovery residences, residential treatment, withdrawal management, opioid treatment program, and medicated assistant treatment. And those services are through Cherry Hill Detox, which has residential program, but also detox and sobering. And our mobile crisis teams can transport people to those facilities as well. Cherry Hill is located in San Leandro. All right. So it was a lot of information in a short period of time, and I'm open for questions. Thank you.
Thank you so much, staff and Stephanie Lewis, for that presentation. We'll go ahead and open it up for questions, but I will kick off those questions first. I guess my first question is, what was the criteria or the framework to determine what services were needed for Albany? If you can provide that. And then also the steps. So you stated if someone calls for services, what does that look like? You come out, if you can walk me through those steps on determining exactly where they're going to go. And then, how do we determine when they're going to be released and where they're going to be released to? So if you can just give me a little bit on that.
Yeah. So yeah, in terms of, the type of team that would be responding to Albany, we just asked Berkeley Mental Health for some data on how many calls they get a month in the city of Albany, and it's average about 4 calls a month, and they're usually generated by law enforcement. And so when someone calls for services, whether it's law enforcement or the general community, we assess what's going on. We make a determination. Is this something that mobile team needs to respond to, or should this person be referred to an outreach and engagement team? And I'll give you an example. If it's a person who is saying, I'm thinking about hurting myself or hurting someone else, or I'm hearing voices, or there's a report that they're just acting bizarre in the community, up all night, banging, making noise, threatening themselves or neighbors, that would be an urgent call, and mobile team would be responding to those calls. And we would assess, we would try to develop a safety plan, de-escalate the individual. But if they meet the criteria for a psychiatric hold, which would be, danger to self, danger to others, or grave disability due to a mental health condition, then we could write what we call a green sheet, which is a form, a 5150, and we would send, complete the form, request for an ambulance, and an ambulance would transport that person to, if they need medical clearance, to the nearest emergency department. If they are checking out medically, they would go to the LPS designated facility. Most likely it would be John George and San Leandro.
Okay, thank you for that. And so I'm looking at the amount of $45,000. So how did we come up with that amount? And where is that amount coming from? Is that coming out of the police budget? Where are we getting those funds? And that's probably a step.
So that was developed by Berkeley Mental Health, that was their cost. That's what they were asking Alameda County to pay them to continue services in Berkeley. They generated those numbers. And I guess I should finish that by saying, in regards to the 45,000, we would be absorbing the cost of responding to the city of Albany. We wouldn't be charging the city of Albany that cost. We serve Berkeley residents. Alameda County residents. Yes.
Okay.
Yeah.
I'll go ahead and let Councilmember Nason, if you want to chime in.
Yeah, what I feel like we need to understand first and foremost is what changes on July 1st from what we're getting now from Berkeley and what we're going to have from Alameda County. And why are we not, for the mobile crisis, why exactly are we not continuing to receive that service from Berkeley? Is the 45,000 considered an unreasonable number? How is that decision made?
Well, I'm not the one who makes that decision. That was our executive leadership that made that decision. So I could get you, I can let that person know, Dr. Karen Tribble, who is the director of ACBH, to answer that question. I think the decision was just made that our North County Mobile Crisis Team could respond versus paying Berkeley Mental Health the extra funds for that. But why that decision was made, I can't really speak to that answer.
So the 45,000, that's not an incremental cost between what it's going to cost Alameda County to serve Albany and what it would cost to have Berkeley do it. That's the total cost.
Yeah, it's not an extra cost for ACBH.
But the 45, what I was asking was the 45,000 that is mentioned, that is the amount, is that the difference between what it's what the programmatic cost from Alameda County is versus what it would have to pay Berkeley for the same services, or is that the total cost?
That is the total cost that Berkeley presented to Alameda County is what they're saying cost them to provide the service in Albany. Berkeley Mental Health Those are numbers from Berkeley Mental Health.
Okay, so so Alameda County, it could actually be costing them more, but they would rather provide it through their own people. Is that correct?
I don't necessarily think it would cost Alameda County more to provide the service. It's not costing us anything extra. We're not adding additional services. We're adding additional city that we're covering.
But that is additional services. I mean, programmatically, if you add a population of 20,000 people with an incident rate of 4 per month, it might not be significant in terms of, you know, the size of the rest of the county, but it's not free. Berkeley says it costs $45,000.
Yeah, that's what they're saying.
Okay, they just don't have the numbers. They don't have a number that we can compare with the 45.
This is the first time I've been with the county almost 14 years. Berkeley has always provided this service. It was, the way I understand it, it was part of one contract. And they billed for services through the county. It was never pulled out as a separate cost, but now it is for them. And ACBH decided that they would not pay it and that we would be providing that service to Albany residents.
Okay, well, if I may comment at this time, I would like to say this concerns me. A mobile crisis, if we have a crisis in Albany, I feel a whole lot better knowing that that's being responded to from Berkeley than being dispatched from somewhere south of Berkeley. You know, Berkeley is close by, and we're kind of a little isolated island. We adjoin several Contra Costa County jurisdictions, but the only Alameda County jurisdiction adjacent to Albany is Berkeley. And I hope we could request more information about this, about why this is being generated from, why our mobile crisis response will be dispatched from Alameda County rather than from Berkeley. And I don't think saying, well, it's not going to cost us anything extra because we already have a mobile crisis, so we'll just add Albany to our list. I don't think that's the right way to think about this. To me, it is a cost, and there is a cost to Alameda County that could be compared with the cost that Berkeley would charge. Let's lay those next to each other and figure out, at least let us know what the difference is, so we can kind of understand the decision-making process that affects our mental health needs and public safety and all the different things that mobile crisis relates to. Thank you.
Thank you, Councilmember Nason. One sec, Councilmember Clay, just to piggyback on Councilmember Nason, is the July 1st, can we push back on that until we get the information we need? Or is it just, this is what's going to happen and we can't really discuss any further on the needs for Albany?
I can take that back to exec leadership and get you an answer.
That would be great. Yeah. All right, thank you. Councilmember McQuaid.
Thank you. I have quite a few questions, a lot very similar to what the mayor and Councilmember Nason have mentioned. You're adding a whole city to what you're providing, but I don't see the other side of the equation where you're adding either more staff, more teams, more anything. That this whole thing actually concerns me a lot. Just say that. What is the guarantee, or your thoughts anyway, that the mobile crisis unit will be available should Albany need it? If they're in Oakland or Hayward or whatever, at best it could be hours before they're available.
Well,
How
the
does that work?
furthest the North County team could be is Piedmont. They wouldn't be coming from Hayward, but it's a significant, space that they would be covering to get to Albany. I'll be completely transparent about that. Our Oakland area is very, very busy, much busier than many cities. And so I'll be completely clear that there are times when there will be a request and those teams will be busy and there will be a wait.
And that's all we do is we just wait? Can we have Berkeley as a backup at least, sort of a mutual aid sort of situation? Is that possible?
I will ask that question.
Do you at this point work with Berkeley Food and Housing in Albany?
No.
And why is that? It sounded as though it sounded to me like there's two separate programs. There's the mobile crisis unit, and then there's kind of an overarching mental health piece, which, as I understand it, has been provided to Albany through the county already. Is that not true?
I can't speak to that. I run all of the crisis services. So the services that I actually presented on is what I am responsible for. So mobile crisis teams and our outreach and engagement teams. So it's very well possible I could get that answer to you.
So
I don't. Yeah.
Your outreach and engagement team does not work in Albany with BFHP. That's what you're saying?
No, we have not.
Do they work through Berkeley?
No.
So we haven't, as I'm understanding this now, we really haven't been getting the services that Albany should have been getting for a long time. And please understand, I'm not blaming you. I'm just trying to understand this.
So, yeah. And this is helpful because there are a wide range of services that the county offers to individuals living in the county. I'm speaking about crisis services, and within crisis services are those outreach teams and our mobile crisis teams. So people have been getting services, just not through crisis services.
Right, no, I understand that.
Yeah.
But the crisis piece, separate from the mobile unit, which we got from Berkeley, the other crisis piece, we didn't get at all. Is that correct?
No, that's not necessarily true. So there are case management services that up until recently were offered through Berkeley Mental Health that are now offered to Albany residents throughout the county.
Okay.
So I do know that that is happening.
Okay, and that'll be a smooth transition for those people?
That has already been happening, to my knowledge. Yes.
So how is the city of Albany, since this is a new program, how are we going to interact with the county to say, this is the greatest thing ever, our fears are unfounded, or this really isn't working? How do we communicate with you all?
I'm not sure. We haven't thought that through yet. This is one of the opportunities to discuss that in coming to this meeting. We use data. I use data to determine, how frequently we're making it to calls, who's requesting calls. But we can think further about how we would get feedback from someone in the city of Albany to know more about if it's working or not.
Yeah, I think that's going to be really important going forward. So now I think that the Albany School District received services through Berkeley Mental Health. Are they now going to the county?
For crisis services?
No, for regular, or for services, I think, within the schools or families in the schools.
I'm not sure.
Okay. Okay, I think that's somewhat it for me for a minute.
All right, I'll go ahead and move along to Councilmember Teeland and Vice Mayor Jordan, and then we'll bring it out to the public and bring it back for further discussion. Go ahead, Councilmember Teeland.
Vice Mayor Jordan can go first. He definitely had his hand up
Okay.
before I did.
All right, go ahead, Vice Mayor Jordan, if you want to go ahead. Or to you. And you're on mute. You're on mute.
Thank you. I've heard of this transition, of course, but don't know many of the details. So my understanding is there's a state funding source that provides funding per city, per population. And that funding was believed to be going to Berkeley, but discovered to actually be going to the county. And that is not just for crisis services, but for the entirety of the mental health services. Is that correct? Is my understanding on that correct?
I can't speak to that. I don't know, but I can ask.
I would
So
imagine
hold on,
staff has to answer that.
Vice Mayor Jordan, hold on one sec. Okay, she just reiterated that she's only here to talk about crisis. I think the questions that we're asking is more in depth to the point where we may have to have her go back and there be more research conducted in order to get it. Because if she doesn't have the answers to these questions, all we're doing is just asking questions without getting a response. So I'll go ahead and let you finish the last two, but let's just keep that in mind that she's just here to speak about the crisis mobile services. Okay, go ahead.
Yeah, well, my intent is actually to ask that question to city staff, because I presume city staff understands the funding picture. Or if they don't, I would like to understand that city staff doesn't understand the funding picture. So my question wasn't actually directed to the director. So I don't know if city,
Yeah. So the funding was thought to go to Berkeley, and Berkeley, through some contract negotiation with the county, discovered that they were never receiving MHSA funding to serve Albany. So then they contacted the county to let them know, and then the county agreed to provide services moving forward.
and this is funding not just for crisis, but for the totality of services.
Well, the county has always provided a level of service, medical to medical recipients, and Berkeley's services were mostly full service partnerships, and they were provided to adults and children. But at a very low level, like they had at the time of the transition, they had about 10 clients that they were serving, and agreed to continue serving if the client so wished.
So maybe let me frame this more specifically so I can try to understand. Did people that needed inpatient mental health, were they referred to John George Hospital by Berkeley, or does Berkeley have its own facility?
I'd have that level of detail I don't have for how the city of Berkeley functions.
Well, I was curious for all, when Berkeley was providing services to Albany, if somebody needed to be admitted for inpatient service and the Berkeley crisis team responded and made that determination, where did that person go?
I can answer that. So if the person needed medical clearance, they probably went to Altabate's emergency department and then to Herrick if they got admitted. If they did not need medical clearance, most likely they went to psych emergency at John George, where they received further evaluation. So that is not changing.
Okay, so Berkeley, while Berkeley was doing evaluations, it was utilizing the county facilities.
Yes.
Okay, so that's not changing. That was one of my concerns, is that if Berkeley has facilities, it would be able to provide people service that are closer into the community that they know, then there presumably be some advantage to that, but it sounds like that's not the case. How much funding are we talking about that Berkeley thought it was getting that it in fact is not getting?
We don't know. That number has not been provided.
Okay, that's interesting. So we don't know what it's kind of a pass-through fund from the state. We don't know what the magnitude of those funds is. Wow, that's quite intriguing.
Well, Berkeley must know how much they're going to lose. No? Sorry.
Yeah, I mean,
I just can't. This is blowing my mind.
Yeah, exactly. Me as well. This is kind of like literally the bottom line of government is like, how much money do you have and where's it going? Was Berkeley's crisis response team available 24 hours a day?
No.
Yeah.
Yeah. Their current hours are, I called today to confirm 11:30 a.m. to 10 p.m. No services on Tuesdays or Saturdays.
Interesting. So no services 2 days a week, which is similar duration, similar number of hours, the days they provide service, but later in the day. Am I getting that right? Okay.
Yes.
What percentage of, and this would apply both to Berkeley and to the county services, what percentage of the time is the available crisis team or teams on a call when another call comes in currently before adding Albany?
Before adding Albany, probably, I'd have to run the data, but probably 50% of the time.
Wow. Okay.
Yeah, probably 50% of the time. But the reality is, it's the North County team, and we carry Oakland radios. So we are dispatched through Oakland. They take priority because we have police radios. All other surrounding cities go through our on-duty phone line where they get a clinician. We triage the call, and then we send we dispatch our teams electronically, but it's a different process.
Okay.
So yeah.
And what is the, since I think we have this from Berkeley's experience for 4 calls a month, what is the call volume before adding Albany for the North County team?
We probably have between 9 and 15 calls a day per shift.
So, okay. And that's all one team, one pair of clinicians doing all that?
Yes.
Wow, they are they're superheroes. That's pretty amazing. So I can see that adding 4 a month is not a dramatic delta in scientific terms on that, but that 2 of those calls per month, the team is going to be out based on the 50% estimate. So it'd be interesting to know. I'm sorry, go ahead.
I was just going to say that is possible. Yes.
Yeah. So it'd be interesting to know the comparator statistics for the service that had been provided by Berkeley before, if that would be possible for staff to get. And let's see. Yeah, I think I'll well, and you said the furthest away that the crisis team would be responding from is Piedmont, but the North County team responds to all of Oakland, right?
They respond to all of Oakland. Yes.
So the furthest would be the San Leandro border.
Yes. Yes.
Okay, which is considerably farther away than Piedmont.
Yeah. Sorry about that. I was thinking of cities in terms of the edge of Oakland. Yes.
Yeah. Fair enough. Yes. No problem. All right. Well, thank you.
Yeah, and I would add too that all of that is complicated by the time of day and if there's traffic.
Oh yeah.
We're out of COVID. The traffic is back.
Yeah, I was going to say complexity is returning in force. Mm-hmm. Yeah. Well, thank you very much for the presentation and for the answers. And I agree with Councilmember McQuay. My goal was not to put you on the spot, but just to try to get the more fullness of knowledge about the situation. Thank you.
Yeah, I appreciate it.
All right, Councilmember Susan. Thank you, Vice Mayor Jordan.
Thank you. Vice Mayor Jordan asked some of the questions I was going to ask, which is why I always let him go first. So I was going to ask about some of the stats, which you just covered. Thank you for that. You said that Oakland takes priority because you're using Oakland radios. Have you explored integrating that same sort of level with the police departments of other cities? Is that an option that anyone else could take advantage of and really integrate you with their services on 911 calls?
Yes, if we have capacity to do that. So that just means that, we have to build capacity. If you have one team carrying a radio in Oakland, that same team would not carry a radio for another city. We would have to create another team, and we don't have the capacity to do that. Our plan is to expand and add more staff and more teams. We just aren't there yet.
Thank you. And do you have that leads into my next question, which is going to be, I'm glad you're thinking of expanding. Is there any sort of thought process on how that would happen and what the timeline would be?
It's all based on recruitment.
Mm-hmm.
And so if any of you are speaking to other agencies in terms of recruiting staff, especially clinicians, there's just seems to be some difficulty in the Bay Area for a number of reasons. But also, we are down many staff. So I don't have a timeline. I will be completely honest. We recruit, a civil service, so it takes a while. So as soon as we open an exam and we get some recruits, we open it again. So it would be, we probably will be adding a few more staff, before the summer is over, and a few more staff before the fall, and then the winter, when we would have a team, enough teams to where we could divide the county by 4 or by 3. I don't have a timeline.
Okay.
But I know it's needed.
Thank you. And to try and get some more stats, do you have any data on, how these calls are working out and also subdivided by city? So of those 15 or 9 to 15 that people are getting a day, which cities is it coming from? And also, where are those people ending up, or how are those calls ending?
So the majority of our calls in North County come from Oakland, and they primarily come from the Oakland Police Department because we carry police radios. And so when a person is placed on a hold, like I said, they go to either an emergency department if they need to be medically cleared, or they go to John George. We also, our 5150 rate is probably around 30 or 40% of those folks we have contact with or fit the criteria for a psychiatric hold. The rest are either diverted to a crisis stabilization unit, sobering and detox, to an urgent medication clinic, left at home, with their support system intact, their natural resources. So it definitely depends on the call.
Okay, thank you.
Yep.
So this last one is for Isabel or Nicole. And I think I understand what we've been saying about, Berkeley versus this and the money. So my question is not what were we giving Berkeley before, because Isabel, you said we don't know that. What is the amount of money that we get from this state grant, as I understand it, that we then are giving to Alameda County now?
No, the city of Albany does not receive any MHSA funding.
Okay.
The MHSA funding goes to the city of Berkeley and the county of Alameda.
Okay. And that is funding that is meant to support the
Mental
services in places that include Albany.
Yes.
Okay, great. Thank you.
All right, I'll go ahead and take this out to the public, and then we'll bring it back for the further discussion. And if you can go ahead and let the public in for 2 minutes, please.
Hi, good evening. My name is Jeremiah. So this service is only available 52 and a half hours a week. That's 10 and a half hours a day for only 5 days a week. Just barely over 40-hour work week, just barely over 8 hours a day. So if a crisis happens in the middle of the night, then what? They just don't get help. Unlike a good service, if it's not available 24 hours, because mental crises happen, they don't just happen between the hours of 10:30 a.m. and 10 p.m. I mean, come on, really? So how many mobile units are there? Just 1 or 2? And what is a mobile unit? Is it an ambulance? Is it a pickup truck? Is it a van? So it kind of sounds like to me Albany is last on the priority list. Oakland comes first, Berkeley comes second, Albany last. I mean, if you're stuck over in Piedmont, right? Like you were just saying, you're stuck in traffic. How long does it take to get back to Albany? I don't know. It sounds like Albany needs our own mental health. You know, instead of Berkeley mental health, we need Albany mental health. I mean, every city should have their own. And what's going on with this state and this country if we can't get organized? This doesn't make sense. We're not allowed to get the MHSA grant. So where this recruitment staff clinician, where's this job posted at? Since you're looking for people, is it Craigslist, Albany City, government website? And everything you said tonight, everything during this presentation, all the phone numbers, where's that going to be transparent and available to the public in Albany? Going to be posted at a bus stop, on the library, on the bulletin board, the city hall?
All right, thank you for your comment. Go ahead, please, Nick.
Sure, Nick Pilch, Albany resident. I would love to be of help if I could. I did have some experience with this as mayor in 2020, although I think that all the information that I had is now out on the floor. I think that the council members are asking some great questions, and I suggested they summarize their questions to both the assistant city manager and the person from the county. And if you do not get answers to your question, that you escalate this in a political manner with a letter. When I was mayor, we did have a meeting with Berkeley staff around this issue. As I started my term as mayor, there was a Berkeley Albany meeting, mental health meeting that stopped occurring abruptly as I started my term as mayor. I think this is probably coincident with the Berkeley realizing that they weren't getting all the funding that they thought that they were. But I will offer here some things really quickly. I did get comments from members of the school district, and members from the school board and others that the mobile crisis unit from Berkeley was very well thought of and needed, and that people were concerned about that going away because they did not think that Alameda County could provide the same level of services. So we asked Berkeley to continue that, to do everything. We stated our intention that we wanted that to continue. Berkeley was going to come back with a number. Apparently that was at 45,000. But good comment. What was the total number that Berkeley was getting, and how exactly are the mental health services split? Anyway, not enough to talk about in 2 minutes, but I'm happy to be a resource if it helps at all. Thank you.
Thank you for your comment. Next, please. Go ahead, Judy. Oh, looks like it's distorted, Judy. If you want to call back, hang up and call back, it's distorted. Okay. If she comes, and please let me know if she comes back in, we'll have her jump in before we move on. All right, we'll go ahead and bring it back to council. Are there any other questions? Councilmember McQuaid, go ahead, please.
Mayor?
Yes?
Judy re-raised her hand, so should we let her?
Yes, if she's back on, that's fine. Go ahead. Sorry about that.
Judy?
No, it's not
Okay,
working.
no.
Okay. All right, go ahead. Councilmember Quaid and Vice Mayor Jordan.
Okay, thank you. Just for me, hopefully a closing comment that I would encourage staff to continue looking at alternatives, even as we try to sort through some of these issues. I just don't see how using the county, at least for the mobile crisis unit, is really going to be beneficial to Albany. I think we should at least be prepared to supplement it in some way. And I would hope that we could find something that we have a little better feel that it's going to be available when we need it and will be available in proximity to the people that need it and not clear at the other end of the county or mid-county. So that is, my thought going forward is we continue looking at alternatives.
All right, go ahead, Vice Mayor Jordan.
Wanted to relay the question that one of the commenters asked, which is what happens when a crisis occurs off hours?
So that law enforcement is requested, and that's anywhere in the county when mobile crisis team is not available, law enforcement.
Okay. And does the county have funding for more teams now, and it's really a matter of recruitment, or is it both a need for funding and recruitment?
There's always need for funding, but right now the biggest issue in terms of our full expansion is recruitment.
And how many teams, if recruitment was not an issue, how many teams could be fielded currently with the funding that's available?
We could at least have someone asked the question of how many teams. So we have 1, 2, 3, plus CAT. We usually have about 8 teams throughout the county, throughout the entire county. In the North County area, we usually have 2 teams. If we filled all of our vacant positions, we could add an additional 4 to 5 teams.
So you would be increasing the number of teams by about half. There are 2 teams that work North County currently that are currently staffed.
Yes.
Okay, that makes sense, because I thought there was one team, and I was like, how do they possibly get to 9 to 14 calls a day with the one team?
And so one clarification I need to make, and it was the reason why I left out East Oakland, because we have a team that focuses on East Oakland in itself.
Oh,
so that North County team that would be responding to Albany would not be in East Oakland. We have a whole different team because East Oakland has different needs.
Yeah, okay. Well, so that goes to the San Leandro border and why you said Piedmont rather than, thank you for clarifying that. I appreciate that. Let's see. Is there any kind of appointed body that advises or works with ACBH? Like the Alameda County Transportation Commission has various advisory bodies, and there's various advisory bodies obviously with county government. I don't know if there's any advisory bodies that are specific to mental health, behavioral health.
There's a mental health advisory board. Yes, there is.
Okay. And are those seats based on geography, or how is that board appointed and populated?
You know what? I'm not sure, but I could, if I'm sure probably Isabel will create a list of questions to get answered. So yeah.
I think that goes to I think one question that's circulating around, which is sort of this: how would the interface work? And that might be the natural interface if there would be an Albany seat, for instance, if that's how that body is organized. And then I guess, and I don't know who this is a question for, but I'm still trying to understand what services did Berkeley provide before versus services that the county provided before. Did Berkeley only provide the crisis response and everything else was provided by the county before, or were there other parts that Berkeley provided before?
So Berkeley Mental Health was and still remains a full service mental health clinic. Within that clinic is psychiatry, crisis services, mobile crisis team, intensive case management, and full service partnerships, which is the highest level of mental health care. And so the majority of the folks served at Berkeley Mental Health were Berkeley residents, and then a small number were Albany residents. The mobile crisis team provided the services to Albany and Berkeley.
And so was the only component that the county, well, maybe the way to ask this is, well, the only components that the county provides to Berkeley, essentially the inpatient services, like John George, the residential treatment, those kinds of inpatient services and everything else Berkeley Mental Health provided?
I don't know how it's divided in terms of the funding because there is overlap. There's some county programs that Berkeley residents can participate in, just like Albany residents can. And there's some services that are for everyone else in the county and not Berkeley Albany residents. Mm-hmm. When the transition happened, the county is now serving Berkeley and Albany residents for case management, mental health, psychiatry, whatever level of that. And then the mobile crisis team was added to that. But I do think that I could find out in detail the who's getting what.
Yeah, that would help me a lot. Just even a rubric or a table like rows by service, and then who was providing what before, or even not even before, but using Berkeley as a model, because that will help me understand what is transitioning and what is not transitioning, and that sort of might either mollify or amplify people's concern. I don't know which, but the data that's there. So, and
I do think that Berkeley, someone should reach out to Berkeley to get the details about what they were providing that they're no longer providing to Albany, and then I can work on the county side to say this is what Albany residents are getting in other parts of our system beyond crisis.
Right. Okay. And then a final question from me, and this is for Albany staff. Does Albany 911 dispatch ever dispatch directly to a crisis team, or does it always go through police as a first stop?
I think it goes to police as a first stop.
Yeah. Okay. It's Albany dispatch to Berkeley dispatch. That's how it goes.
Mm-hmm.
Oh, and one more question. Does the county have a mutual aid agreement with Berkeley crisis response?
No.
Okay. Thank you. Thanks very much.
Mm-hmm.
All right, I'm going to take a pause before I get you, Councilmember Nason and Councilmember Tiedemann. Let's see if we can get Judy Kerr to voice her comment really quick.
Testing.
Yes, we can hear you. All right.
Okay, that was a technical challenge and I survived. I want to thank Isabel Leduc, Assistant City Manager, and Stephanie Lewis for their comments and their information this evening, and for the council for very, very good questions. And more conversation, which will follow. As a former member of the Albany Berkeley Mental Health Commission, and as a current member of the Finance Advisory Committee, I am stunned by the $45,000 number that the city of Berkeley suggested to Alameda County for the cost of services for four calls per month. Even if you figure in, it doesn't pencil out no matter how you calculate it. Even if you figure in $150 an hour for 30 minutes of a psychiatry consultation, you still can't get to $45,000. So I think the county was well advised, and I think Director Tribble may have made a good decision to actually shift this over to the county. That said, I think the concerns that have been discussed tonight are very valid, and I think we all need to be cognizant of how we're going to best coordinate going forward. The turnaround times, the response times, the outcomes, all of those issues need to be data that is presented publicly and that the citizens of Albany can access. Hopefully that comes to the Alameda County Board of Mental Health. I don't know, Stephanie, maybe you could quickly nod yes or no, or not respond. We can get that answer later, but we need to know that information. We need to know what's happened and what's changing. And as to programs that were previously provided by the City of Berkeley Mental Health Commission that are now provided by Alameda County, I honestly think that there's a possibility that there's more comprehensive services available at the county. So those are my comments. Thank you.
Thank you so much, Judy. Go ahead and bring it back to Council. Councilmember Nason, Councilmember Tiedemann, you'll wrap this up for us. Go ahead, Councilmember Nason.
Yeah, sure. I'm not going to agree on the idea that 45,000 is a lot for 48 or so crisis responses over the course of a year. That's less than $1,000 per response. And if anybody here has ridden in an ambulance or paid a psychiatric bill or anything lately, I would say that actually seems like a fairly that seems like a fairly reasonable amount, especially when you consider programmatic, administrative costs and so forth. And it does seem to me that it would cost significantly more for crisis teams to come from a longer distance. If you have the same crisis, the same burden of a crisis team, but they're traveling a lot further in each direction, that to me, that it seems that inflates rather than saves money. But overall, I just want to reinforce what I think you're hearing from a lot of us, which is just this concern about distance and the ability to serve Albany from a distant area. We do need to take a look at what options, if any, exist for Albany, and how best to serve us. And so we do want to keep advancing these inquiries and revisiting this. Thank you.
Thank you, Councilmember Nason. Councilmember Tiedemann?
Yeah, to agree with some of the other council members, I think this has given us a lot of food for thought and stuff that we should keep thinking about and talking about, especially as the lessons I think it's made clear are that I think we all want more mental health crisis services than this currently offers us, and that the services that do exist, or the model that we see, works best when as closely integrated with police and other public safety measures as possible, which I think is very important to remember. And I also think it's very important to remember that, we had one public commenter say every city should have their own version of this. I would love for Albany to have its own version of this that we run. I don't think it's possible just due to economies of scale and how these sorts of things work. So I think the solution is going to be larger than Albany to some extent. Whether whether we can develop something that's a little bit more ambitious and that may be a little bit bigger than Albany, but a little bit smaller than the county, and might involve moving funding around that we have now that we're using for other purposes and rethinking about how we do public safety. I think that's something to really think about, and something that I'm hopefully going to work on. We can talk more about soon. So I think this is a good conversation for us to have had.
Thank you so much, Councilmember Tiedemann. Thank you, Ms. Lewis, for bringing this presentation to us. I know we'll be in contact with you as the questions continue to progress. We will work with Assistant City Manager and City Manager to get some of the answers that are much needed in regard to the services that are being provided for Albany. That's it. Thank you so much.
Mm-hmm. Thank you. Have a good evening.
You as well. All right. Well, Vice Mayor Jordan?
I was just saying goodbye.
Okay.
Thank you.
All right, we'll
Bye-bye.
go to item number 9, please. Public hearing, and I'll turn it over to the city manager and staff.
All right, can you hear me? Yep.
We can. How you doing, Mark?
Good. So good evening, Mayor and Council. So this agenda item is a second step in a 2-step process to levy the assessments for the 88-1 Lighting and Landscape District for fiscal year 2022. As you recall, at the last meeting, June 7th, Council acted to initiate the proceedings for this assessment, approve the annual report. And in this annual report, it details the assessment, how the assessment's calculated, the boundary map for the assessment district, and then how we intend to use the funds. And then we also declared the intent to levy and collect the tax, and then set tonight as a public hearing for this item. In general, the funds from this assessment can be used for the installation, service, and or maintenance of public landscapes, parks, recreational improvements within the district. And then again, the district roughly is the city boundary, so anything within the city. For 2022, we are proposing to use the funds to support maintenance activities in the areas of street landscaping, parks, playfields, vegetation management at the waterfront, and the tree program. We're also holding a portion of the funds, approximately 25%, a little bit more, for a capital reserve. And this is in case something breaks or we need to spend money that's unplanned, we have some reserve money that we can use. And obviously that would come to council for authorization. So tonight's action, we're going to adopt a resolution 2167, and this will confirm the assessment and the diagram. And again, that's detailed in the report. It'll levy the assessment and then order the levy to be placed on the property tax rolls. And so with that, I'm happy to answer any questions.
All right, thank you, Mark. Are there any questions from, it's like Councilmember Nason? Go ahead, please.
Well, my apologies if I'm confused, but I understand it did not exactly jump out from the materials. Do I understand correctly that what we're doing here is basically keeping the income side the same, that we're levying the same amount as we have in the past, but the documents indicate a very different expenditure plan, but the expenditure plan will return to us for review. Is that?
So
the expenditure plan looks very different. The levy looks the same. The expenditures look completely different, but there isn't really much explanation.
Sure. So let me give some background on that. So first of all, the assessment. The assessment hasn't changed since I believe 94 or 5. So the dollar amount's been the same since that time. There is a drastic change of how we're using the funds, but this is tied to our restructuring of the public works budget. So what you see here and what you see here on all the years when it says park maintenance, that's not how much we spend for just park maintenance. That's a portion. That's only the portion coming from the 88-1. So in our update of the public works budget that I think we first presented in September, and then it was been incorporated in the amendments to the budget, and as well as in this recently passed 2-year budget update, we have the whole structure. And so where we have and what we've done is try to align our activities with how we account for align the activities with the accounting, and then use the special revenue funds in a way to maximize our flexibility. So in the case of one of the big changes that was pointed out was street trees. In the past, it was fully funded by the 88-1. Now it's split between 88-1 and Measure M. So in each one of these areas, the total amount that we're spending on the individual program hasn't changed. It's just where we're funding it has changed.
Okay, well, if I can inject a note of caution here, when we campaigned for Measure M, and I think I wrote the ballot statement for that one, and I'm a big parks maintenance enthusiast. We want you to have flexibility, but we also want, and we really need, to fulfill our promises and representations to the voters. And I know that I have been asking for, some better understanding of park maintenance historically and now. And obviously things have changed with Peggy Thompson Park, and also with the Albany Waterfront Park becoming a wildly popular destination that needs a great deal more care. But now we face the problem of the forest on Albany Hill. There's, it never ends. But it's important in terms of flexibility that we not play a shell game, that we not end up having more money for park maintenance approved by the voters and having the same park maintenance, on the ground, especially if that level of maintenance falls below a reasonable standard. So we really do need to understand where the money is going, that we are keeping faith with the voters, and we're not making it so flexible that money approved for park maintenance is all ending up, funding pension obligations from the past and that type of thing. Thank you.
Sure. Let me, so in this, I think we absolutely agree that we want to increase the level of service that we have across all our parks, and we have structured the budget, and you can see very clearly about what the whole total amount is, and we've increased marginally each one of the areas, and we're going to hold fast to those numbers in the budget.
Well, I hope that we're going to come back to this discussion when there is more information available about how Measure M funding has been spent, how it will be programmed, and we can look at that together with this.
Sure.
Thank you.
Thank you, Councilmember Nason. Any other council members? I'll go ahead and go out to public comment. Right, like we have one public comment. Go ahead, Ann.
Excuse me. I was just trying to swallow my Gordo's burrito. So, any of these plants going to be drought tolerant? Or are you going to just pick plants that require a lot of water? I noticed at the Albany Hill, there's no water up there. There's no drinking fountain at the public park. There's no water. And the Albany bulb, I was thinking landscaping. How do you water the landscaping when there's no water? Like at the Albany beach, there's no drinking fountain. It's a dog park, but there's no water for even dogs to drink. There's not even water to wash your hands after going to the bathroom. So I think the parks and the cities, maybe we can get a little more organized so we can have the basic human necessities. Water is pretty good. Let's see. I guess the East Bay Regional Park just manages the Albany bulb, and the city still owns the actual land and the property. East Bay Park is just managing it.
No.
Let's see here. I think that's it. Thank you.
Thank you so much for your comment. Who was the last one? Go ahead, Brian.
Okay, thank you. Hi, this is Brian Martin. I'm a commissioner on Parks and Rec, but I am speaking as a private resident. I had submitted questions in advance that I don't think I heard any answers to, but it sounds like Commissioner Nason, Councilmember Nason raised some of those, and I think it's important. I believe that Public Works presents, I believe it's twice a year, to the Parks and Rec Commission on park maintenance. I think for transparency, it's going to be important for those kind of things, and when presented to the council, funding decisions like this, that the whole, all the pots of money are on the table, are reflected, so that decisions can be made well and the public can see where it's all being spent and how it's being spent when there's different pots of money, and if only certain parts of it are being considered at any one time, the whole thing, the big picture needs to be seen. So the public does have an opportunity to see those a few times a year, like I said, is my understanding. And those hard numbers should be presented in that kind of forum as well. Some of my questions, I guess I'll read them off the agenda, include and it sounds like this council isn't approving those spending levels today. If staff could clarify that, if council is approving those funding levels that are in the agenda in the report, then that's a whole nother matter. And if Albany Hill vegetation management funds could be used from this, I'd like to hear if that's possible. Thank you.
Thank you so much for your comment. All right, I'll go ahead and bring it back to council. And if possible, if staff could address some of the concerns Mr. Martin brought up, please.
So yes, we did submit a written response to the questions that he submitted. I'm sorry it didn't get to him early enough for this meeting, but we can obviously get that. But so just touch on a couple of high points. The numbers baked in here were already presented and incorporated in the 2-year annual budget that was approved last council meeting, and so this is just the functional part of assessing that levy to support that budget.
All right. Thank you.
And with respect to Albany Hill, yes, these funds can be used for vegetation management at Albany Hill. And I think one of the questions was, can it be used for vegetation management on private parcels? No, that can't be used. These funds can't be used for work on private property, but they could absolutely be used for vegetation management on the public parcels on Albany Hill.
Vice Mayor Jordan.
Thank you. The section 2 of the levy report, 2.1 operation and maintenance activities, it lists that park maintenance subdivision 2122. The funding can be used for these various maintenance purposes in city parks, including, and it provides a list of parks. I presume including is by way of example rather than by definitive, because some of the parks and open spaces aren't listed there. So I think that can create some confusion. So even if it legally is what I think it is, it might make sense to in the future add in the other at least larger parks people are aware of, like Terrace Park and Albany Hill, just so that people don't get a misconception there. I should check, is my conception correct? My understanding correct?
Yes. The park maintenance should have included Terrace Park, and I'm sorry, I fixed one thing from last year where I had was it future Peggy Thompson Park, and I corrected one, and I think I deleted the other one. So I will make that note and make sure we correct it. But so the intent of this was to outline, and there's a tie to our subdivision of how we sort our money, align our budget with our activities. So it's supposed to be all encompassing, that it supports all the activities within that subdivision.
And in subdivision 2122, is that where Albany Hill would fall, or is that in a different subdivision?
So one of the things we have in this new budget, which I think is a big improvement, is we have a subdivision specifically for open space, and I don't see it listed here, and I'll get that fixed for next year. But we have creeks and open space have a specific subdivision with specific funding that comes from 88-1, some balances in Measure R, as well as Measure M. And so I think that's actually a large improvement where we have now dedicated focused funding for these open spaces and creeks.
Yeah, that's great. And then just to confirm, that subdivision not appearing here doesn't mean that the funding cannot be used for that subdivision.
Correct.
Okay, thank you for confirming that.
All right, I don't see any council members' hands raised. We'll go ahead and have a motion.
I will move resolution, if I can get there, I will move resolution 2021-67 as presented.
Seconded.
Okay. Roll call, Ann?
Councilmember McQuay,
Yes.
Councilmember Nason,
Yes.
Councilmember Tiedemann,
Yes.
Mayor Gary,
Yes.
and Vice Mayor Jordan.
Yes.
The motion carries.
Thank you so much, Ann. We'll go down to item number 10, unfinished business. This is the update work plan template for advisory bodies, city council, Vice Mayor Jordan and Councilmember McQuaid. Go ahead, please.
Yeah, so by agreement, I'll go ahead and present some of the changes that were made by the ad hoc committee, I guess, if you will, that the council created of Councilmember McQuaid and myself relative to the prior template that I presented. So there's upgrades in terms of schedule. And so just to run through that quickly, the schedule is that the work plans will be developed and approved in the first half of odd years, which is essentially the same as they are now. That advisory body, but it's spelled out more in the preamble of this version of the template. Advisory bodies would review their progress midway through the work plan period, which would be June of the even year, approximately. And that the advisory body at the end of its term, or the term of an advisory body, which is not aligned with the work plan period term, since the advisory bodies exist more on the calendar year than fiscal year. So at the end of a particular advisory body's session or term, which would be November or December of even year, that body would perform an assessment of how the work has progressed. And the reason for doing that rather than kicking it to the new version of the body is because you will lose some of the institutional memory with member turnover. So the thought was having that prior advisory body, that was the body that worked on the plan, to fill the plan for 3/4 of its existence, do that work at that point so they could hand off sort of a state of affairs to the next version of that advisory body. So that was the concept of how the scheduling would work. Previously in the template, there was a recurring items section that was separate from the one-time items section, and that got divided into two sections. One is regular reports, which are not items that there's typically action upon. And then another is recurring action items. And there are examples given in the template of each of those as they come up in front of some of the bodies. And then finally, rather than having as is a line or a direction in the current template to prioritize the work plan items, which happen more or less, I would say, in practice, to eliminate that, because the goal is to actually have the council approve a number of items for work that more closely matches the capacity of the body, and that the council would have as guidance in doing that the review of prior work plan and items that were worked upon, completed, and not worked upon, to understand the actual working capacity of that body. And so if the council does its job in sort of tuning the amount of proposed work to the actual work capacity, then prioritizing those items is not as important. But what was brought in was to provide a clear designation of those items that are required by law, essentially, and those items which were desired. So, for instance, having served on the Transportation Commission, I know there's certain things that have to come before the Transportation Commission for approval of funding and spending. So those are the three more substantive upgrades. Certainly, Councilmember McQuaid has anything else you'd like to add that I missed? I got it, apparently.
No, I think that's great. Thank you.
Yeah, sure. And so if anybody else has questions, happy to answer them.
All right. Thank you, Vice Mayor Jordan, Councilmember McQuaid. Any questions or comments from the council members? No?
Good work.
Sure.
Thank you.
Team effort.
Very good. All right, we'll go ahead and take it to public comment. Looks like we have one.
Yeah, thank you. I'm just looking where it says on the work plan template here. Scroll down a little bit. It says SEJC reports, reoccurring reports to the body such as collision reports, transportation, social services to SEJ. Is that Social and Economic Justice Commission?
Yes, well.
It's okay.
Just comment. Are you done with your comment, Jeremiah?
Not yet for the entirety. Social service to So if a commission has an amendment to the work plan, they would just an advisory body would just submit a request for amendment to city council, and we could just add something to the work plan. I was just trying to understand exactly what's going on with that. Thank you.
Thank you so much for your comment. So.
That's it.
All right, go ahead, Vice Mayor Jordan, if you want to address any comments.
Yes, the commenter is correct. SEJ, standing for Social and Economic Justice Commission. Might be better if it was spelled out to avoid using acronyms. So thank you for pointing that out. And as far as work plan amendment, yes, the process as it currently exists and is not proposed to be changed as a part of this template is that if a body wants to work on an item that is not currently approved for work, that it would need to send up a request to council for approval before it started working on that item. And I expect that might occur more commonly under this council and this template if the council does manage to tune the proposed work to the actual capacity. There's more of a chance that the body will get through that work and want to bring one of the items up from its potential work section, which is at the end of the template. So that's at least how I envision it. It does occur to me, since this is a template that staff will obviously need to use, and the city manager did look at it, but I don't know if staff has any particular questions about how it would be used. And we could also discuss that offline, but thought it was reasonable to open it up to staff if there are any outstanding questions.
Thank you, Vice Mayor and Councilmember McQuaid, for working on this and coordinating with me. I really appreciated it. In terms of application, I think that we will need a little bit of wiggle room as we get used to the template, and you may see a bit of variation as the work plans are presented to the council. And I think we'll just fine tune it over time.
Very good. Thanks for your forbearance. I know it took a while.
Councilmember McQuaid, go ahead.
Thank you. I was just sort of going to piggyback a little bit on that we all need to be a little bit patient this first year. I don't want to have the advisory bodies go back and really dig into what happened in the past. I think, a summary of the previous work plan is fine for this year, with the understanding that from the end of 2022, they will write a more comprehensive report. We sort of need to get this moving. And so with the idea that this is the model, and I think as Nicole said, we'll be flexible this year, but we'll be striving for this, and especially going forward.
All right, thank you. Can we go ahead and get a motion to move this forward? Vice Mayor Jordan.
My keenest desire is at least to have each work plan item from the previous work plan with simple rating of 3 categories. Was it worked on? Was it completed? Or was it not worked on? because that's important for me to understand, get a better picture of, what has been the historic capacity of this body. And if it's been given way too many items in the past, then I think it's at least incumbent on me as a council member to say, yeah, well, I'd like that many items to be worked upon. It's not realistic. And so I need to curb my appetite. So hopefully that wouldn't be too complicated to get done, just that simple rating. But that's my hope. Thanks.
Thank you, Vice Mayor Jordan. Can I get a motion to move this item forward? Go ahead, Councilmember Tiedemann.
Move to adopt the new template.
I'll second. Go ahead, Ann, with a roll call.
Councilmember Tiedemann,
Yes.
Mayor Gary,
Yes.
Vice Mayor Jordan,
Yes.
Councilmember McQuay,
Yes.
and Councilmember Nason.
Yes.
Motion carries.
Thank you so much, Ann. Let's go to item number 11 for new business update to the City Albany Traffic Calming Policy. Go ahead and turn it over to staff.
Good evening, Mayor and City Council. Justin Freed, Transportation Planner for the city. Well, I'll be presenting this item tonight. In this presentation, I'll briefly review changes being proposed for adoption by the council to update the city traffic calming policy. This policy outlines the process and criteria for reviewing requests by city residents for traffic calming on their street. The City Council last updated the traffic calming policy in January of 2015. The current criteria for evaluating traffic calming requests includes a volume cap of 3,000 average daily vehicles, meaning blocks with greater vehicle volumes would not warrant traffic calming. The speed criteria utilizes what is called the 85th percentile and calls for physical improvements like speed humps for blocks with 85th percentile speeds above 30 miles per hour and striping and signage treatment for blocks above 28 miles per hour. The 85th percentile speed is a measure that's borrowed from the traditional methodology used for setting roadway speed limits. It is the speed at which 85% of vehicles are traveling slower and 15% are traveling faster. The proposed change for the speed metric is to the average total number of vehicles traveling faster than the speed limit on an average weekday. And I'll go into a little more detail on how the commission got to this metric. The 85th percentile speed is agnostic with respect to the number of vehicles traveling. A street with double the number of speeding vehicles could have a lower 85th percentile speed if it also had more than double the number of vehicles traveling at slower speeds. The Commission has discussed this issue regularly when reviewing the requests. In the fall of 2020, the Commission established a subcommittee to take a closer look at how to measure injury risk associated with vehicles traveling at different speeds. The subcommittee reviewed studies of the risk of severe injury associated with various vehicle speeds and developed a risk metric incorporating the number of vehicles measured traveling at each 5 mile per hour increment. Utilizing a sample of previous traffic surveys for traffic calming requests, the subcommittee found that the volume of motorists traveling over 25 miles per hour was strongly correlated with the calculated risk of severe pedestrian injury. Essentially, the volume of vehicles traveling over the speed limit determined the overall risk, not the underlying distribution of those speeds. As a result, the Transportation Commission is recommending this simple average daily count of vehicles traveling over the speed limit as the measure for prioritizing blocks for traffic calming treatment. The proposed update also removes the 3,000 average daily vehicle maximum in favor of a more limited set of streets excluded from consideration for the traffic calming through resident petition. These are major arterials and truck and bus routes. Minor arterials and some collector streets would newly qualify under this change. A number of these, including Masonic, Key Route, and Santa Fe, have traffic calming measures on certain blocks already through city-initiated traffic calming projects. Staff is proposing that the prior approved projects remain in the queue for project delivery and that new requests from blocks not approved under the existing policy that may bump up in the prioritization under the new proposed policy be allowed to resubmit. Much of the petition process for demonstrating resident support for the traffic calming measures and acknowledging potential impacts remains in the updated policy. And with that, staff is recommending council adopt resolution number 2021-51, updating the City of Albany Traffic Calming Policy as outlined in this presentation, and I'm available to answer any questions.
Thank you, Justin, for your time. Go ahead and open it up for questions or comments to the council members.
I have a lot of comments or questions, actually.
Okay.
So one of the things I noticed as a change was that one resident on the block can start the process, whereas before there was a petition of the neighborhood before it came to staff the first time. So am I correct that now just one person can do it, can ask for a survey and it will happen regardless of anything else? And Justin, maybe it would be good if I asked all my questions, so that would that help you or not?
Sure.
I just think there should be neighborhood input from the very beginning. Anyway, and before there were different solutions for different problems. In other words, there were sometimes soft treatments that staff could actually recommend and install without even going back to the commission. Is that no longer possible? And I'm interested in why weekends aren't included, because I would think that perhaps over near a park that there'd be many people going to the park on the weekend, and that may increase the volume, and so you're getting a different number. I'm not sure. Originally, I had a statement in the policies: speed treatments shall not punish motorists driving at or below the speed limit. And I'm curious as to why that was removed. And then how priorities will be determined. It seems like some blocks will continuously be dropping to the bottom of the queue and will never get any relief, even if they meet the criteria, if someone else comes with sort of a bigger problem. So those are my basic questions to start.
Sure. Sorry, I was trying to get those all down. I may have missed the last one, but you'll let me know if I skip it. For the one-step or two-step petition process, the current policy does identify a petition and then come back for a second round of petition. That's not something we've been doing in practice the last couple of years, and I didn't see a bunch of sort of two sets of petitions from earlier before I came on. Partly, the speed surveys are useful for city staff in general to have a sense of the speeds and volumes. And so if there is concern in different streets, I've been more inclined to get some information on those at the outset. And it's a relatively straightforward piece of the process to collect some data. And I've been identifying for folks that they will need to get the support of the block in order to get the recommendation, and outlining what that some neighborhood organizers that have been leading these have done that earlier, some more closer to when it's presented to the commission. But I haven't been forcing them to do that 2 times around in the last couple of years. The question with regards to different solutions, that is still on the table. The idea is that the commission would review the requests and identify which one should proceed into design. And in design, we would still have the full suite of options that we've used in the past. It's not precluding a particular design or feature be what is recommended. Why weekends weren't included, partly this is a function of us doing generally 1 week surveys, and we don't always have the same number of weekend versus weekday data. And usually there's lower volumes on the weekend. Some places for a particular place might have higher volumes. If there's a particular issue on a particular day, we can still identify that if we see that in the survey data. But to compare apples to apples, we stuck with weekdays just so it was more consistent comparison across all the surveys. With regards to the language that speed treatment shouldn't punish motorists going under 25 miles per hour, I think our designs are consistent with that. But if you want that language to maintain in the policy, I don't see a problem with that. I just didn't see it as a necessary element of the policy language. I think there was one last one that I didn't catch down. If you could repeat that.
How priorities are determined. It seems like some blocks could continuously be being dropped to the bottom of the pile and never get any relief.
Yeah, so we had some discussion on this, switching from a yes/no kind of threshold to one that you just get a ranking. And the idea, I think, behind this is that no one is told no, but we're clear about when we're pulling requests off to proceed into design. So we don't have a lot of yeses that stay having been designed and been vetted, but are waiting for a while before we can deliver. But we have, when we're reviewing new requests, we have the full list of neighborhood requests, and we've identified how many should be designed and ready to be delivered that we can better hand off for project delivery is the intent with that.
So that brings up one more question. I thought I heard you say there's no one receives a no answer, but couldn't a no answer be reasonable if they don't meet the criteria?
So if they're on a particular street that doesn't qualify, that would be a no. But if the metric is just the number of average vehicles going over 25 miles per hour, there's no threshold that is a no. It's clear that they're lower on the list if they're among a list with a bunch of others, but as the policy is written, there wouldn't be a no threshold. There was some discussion over whether there should be a 100 or 200 vehicle, you could set a threshold that it's a clear no, that it doesn't merit the resources if we whittle down the list to get that low. But that was not the recommendation.
Okay, thank you.
All right, I'll go ahead and send it out to public comment. Looks like we have one. Go ahead and let him in.
Hi, good evening. I looked really, really good and I double checked. And in this transportation plan, it doesn't mention anywhere like school zones, like regarding to reduce speed around schools in Albany. The slowest speed in front of our preschools and elementary schools is 25 miles an hour. I mean, even during drop off and pickup time, the speed's still the same. So, I mean, I think I've been mentioning school zones for over 10, 12, 15 years now. I don't know how long it's been. I think if that could be used, because anything around the school within 1,000 feet would automatically have high priority. You did mention pedestrians, high priority, getting hit by cars. These, kids that haven't learned to cross the street yet. I mean, I still see parents in Albany riding with their kids on bicycles across a crosswalk. I mean, I was raised, walk your bike across the street. But I see all over parents teaching their kids to ride their bike across a crosswalk. I don't know if that's education. It just doesn't make sense. Maybe in front of the schools, we could put raised crosswalks. It's a speed bump or a hump. What's the difference between a hump and a bump? I mean, so in the year 2020, how many of these speed studies were done? How many speed surveys did we do an entire year last year? I know I have over 800 signatures on a petition with the city clerk filed for school zones. So I just want to say, hey, check out the Pedestrian Safety Act. Pedestrian Safety Act.
All right, thank you for your comment. I'll bring it back to council. Are there any last comments, questions? Go ahead, Councilmember McQuay.
A couple of things. The resident who is at the speed bump itself is the most impacted by this treatment. And I just think that should be acknowledged somehow. Not that they are able to say, I definitely don't want it, but I think there needs to be a discussion. If they're vehemently opposed to it, perhaps it could move down to another house. I know in the past we've had those discussions, but I think it's important to call that out. And I also think somewhere there should be language to manage the expectation on this, because I think people sometimes have the idea that, well, I did the speed survey and next week a speed bump is going to magically appear on my street. And we know that it could be a very long time before a speed bump appears. So it just seems managing the expectation of the community is important on this. And just as a final thing, I would like to keep the statement in about not punishing people who are going the speed limit. I think that can be done. I don't think it always is in our speed humps and bumps that we've put in. So I think that's important.
Okay, thank you, Councilmember McQuay. Vice Mayor Jordan, want to go ahead?
Yeah, I would support those, and I agree. Our speed hump quality control has varied considerably over time. So some seem to let drivers go 28 miles per hour, and some seem to be quite uncomfortable at 25. So I think it's a good statement to reinforce that. Having been on the Transportation Commission when this went through, I thought it'd be useful to give a little more perspective on what it found in terms of managing risk. Moving the traffic calming policy to being risk focused is to move the city expending its resources where it can reduce risk the most. And so in reviewing traffic calming projects that have been done in the past, it was found there were streets that had as few as 100 motorists going over the speed limit and only 20 of those going over 30 miles per hour. Whereas there were other streets that had 1,000 motorists going over the speed limit and only 100 of those going over 30 miles per hour. And so the second street didn't qualify for traffic calming, even though it had much higher risk by dint of the volume of motorists who were speeding on that street. So this was the change in perspective that resulted from that. Is if the city wants to manage risk, then it really needs to look at the volume of motorists that are going over the speed limit being that limit which the city has decided is the speed at which the risk is tolerable. And so the Councilmember McQuaid is right. If I'd be surprised if there's any streets where there are no motorists going over the speed limit, but the answer would be no if there was such a block. But for blocks that have very low motorist volume, they would remain at the bottom of the list until those more hazardous blocks had been addressed by the city. So it does have that consequence, but the goal is to get the most benefit from the expenditure of city monies in terms of risk reduction and quality of life improvement.
All right, thank you, Vice Mayor Jordan. Councilmember McQuay?
I'm sorry, I wanted to add one more thing. I was on the old traffic and safety the last time we did this. And one of the things that I thought was fairly useful was enabling staff to, after evaluating a situation, to do a soft treatment without coming back to the Transportation Commission, but to sort of take it upon themselves to if it's a painting or putting like on Santa Fe, the crosshatches, and not getting sort of stuck behind the agendas of the Transportation Commission, but being able to take action on their own. And I'm wondering if that's still possible with this plan, or does it always have to come out of the Transportation Commission?
I think that would still be possible with our other projects that we deliver. One thing that I would strive to incorporate into the discussion as new surveys or new requests were brought to the commission were, what's the upcoming pavement management streets that are in the queue? Is there any way we can deliver any of these in conjunction with other projects? But if we had, a striping project or something where we saw an issue we could address more quickly, I think we would still be able to do that.
Great.
All right, are there any other questions or comments from council members? All right, we'll go ahead and get a motion.
I'll move resolution 2021-51 with the addition of the language for speed treatments not punishing motorists driving at or below the speed limit.
I will second that.
All right, thank you. Go ahead and do a roll call, Ann, please.
Councilmember Nason,
Yes.
Councilmember Tiedemann,
Yes.
Mayor Gary,
Yes.
Vice Mayor Jordan,
Yes.
and Councilmember McQuay.
Yes.
Motion carries.
All right, thank you very much. Thank you, Justin, for your presentation. All right, let's move to item number 12. This is council subcommittee reports, council member reports on appointed representation of Albany and other meetings and events all at once. We'll go ahead and start with council member Nason. No? Council member Tiedemann?
Yes, the main one was I attended the last meeting of the EBCE board where we went over our budget and had a robust conversation there. EBC is a very technical committee and I'm still getting used to going through budgets. So it was an education and we sent it back and passed it with the request of having more in the community investment arm of EBCE. So there will be more news on that eventually. Otherwise, I attended, as I think most of the other, in fact, all the other council did, Albany Democratic Club meeting that had a conversation about and a forum with representatives from the various parent groups that I thought was very substantive, which had some good speakers. And I think many of us attended the Juneteenth event that Mayor Gary put together. So let me just say once again that she did a great job of organizing there.
Great. Thank you, Councilmember Tiedemann. Vice Mayor Jordan?
Yeah, I unfortunately had to miss the Alameda County Mosquito Abatement District meeting due to a family health emergency that occurred. And that continued, and I extend my thanks to Councilmember Nason for attending as the alternate Stop Waste or Waste Management's Programs and Administration Committee meeting. So thank you, Councilmember Nason.
Thank you very much. And Councilmember McQuay?
Attended the Housing Authority meeting, obviously the ongoing webinars, and I had the honor to attend with the graduation celebrations for Albany High School, the put on by the Black Parent Engagement Group, the Latinx graduation celebration, and also the Indigenous People celebration. I had a question for Councilmember Tiedemann, if I may, just a really brief question. I understand one of the comparable to EBCE organizations in Southern California is going or is on the verge of bankruptcy or is concerned about bankruptcy. Is there any concern with EBCE on that?
No, we got an update on that a couple meetings ago when we heard that news, and it's obviously a shame, but that is not something that I think there's any fear about for EBCE. We seem to be doing pretty well.
That was my impression. I just wanted to check with the expert.
Yep.
All right, thank you, Councilmember McQuaid. I attended the mayor's conference. Looks like we had a presentation regarding the status of water supply and the California drought. It was very informative. The mayors of Alameda County also passed a Juneteenth resolution drafted by myself. Looks like Juneteenth Independence Day. We also made some appointments, and basically it was a short meeting. So other than that, I attended a couple of graduations and various Zoom meetings as well. All right, we'll move to item number 13 for any future agenda items. I'll start with the Vice Mayor. You're on mute.
Nothing at the moment, thank you.
Okay, Councilmember Nason.
Not that I haven't mentioned before. The one significant one would be talking about the waterfront, which will come back the second meeting in July.
Okay. Councilmember McQuaid.
Nothing right now.
And Councilmember Taylor.
Nope.
All right. Any council members have anything they would like to address before the announcements of city meetings and events? Not govern yourself to those upcoming events. I have one thing that I would like to say. Go ahead, Councilmember Nason, and then I'll speak after you.
I just wanted to say that Juneteenth was marvelous. I think we were all or almost all there, and it was something really special. And I want to express my appreciation to Mayor Gary and Robbie Abrams and all of I know that many people pitched in to make that terrific event happen. Thank you.
Absolutely. Thank you, Councilmember McQuaid. It was brought to my attention after the community task force that a member of that task force was approached regarding questions on how things are going to be presented to the council. I think that is not appropriate in the fact that these subcommittees is in progress, right? And I think as council members, vice mayor, mayor, we shouldn't be talking about things that are going to be presented to us in a way with any members on the task force committee. One of the questions was presented that if the task members reach out to the community members, and absolutely they should, to get information or at least to do a survey on the items that are needed. But simply asking questions as far as how things are going to present, or at least structured in a way that's going to come to the council, I don't think that's fair. And I think as council members or elected officials, we should be mindful of the discussions that we're having with community members, so it don't look like we're rehearsing any type of things that we would want to see out of this task force. So I just wanted to state that before we end the meeting. With that said, I want to thank Vice Mayor Jordan, Councilmember Nason, the city attorney, Councilmember McQuaid, Councilmember Tiedemann, and the city manager for an excellent meeting. And I wish you a great week. Good evening.